Well, COVID cases in New York City are surging, with officials now back to recommending masks indoors. Our very own health reporter Anjalee Khemlani is following the story. Anjalee, what do we need to know?
Well, Rochelle, what this is basically a strong recommendation from New York City's health department. This is the second time that we've seen this recommendation in the past 3 months, and that is a result of the latest Omicron subvariant BA.5 taking hold. We've seen really across the country some indications that we might be experiencing what could be a new wave. What's at play here, as you can see on your screen, is this new highly transmissible subvariant. It's got a few different symptoms from the original and earlier strain, so it's harder to say, specifically if someone has it, and it's harder to track these cases as a result of more in-home testing and at-home tests. So that's really where a lot of this is coming from. Right now, the CDC estimates that BA.5 makes up 54% of cases, but a lot of experts say that number could well be higher, again, as a result of those at-home tests. Now, what we have is New York City really serving as a bellwether for the rest of the country, as it has been throughout this pandemic. And the CDC has been keeping track of two different metrics that might seem confusing, but let's take a look at them. On one hand, you have the level of transmission, and that is a different number than really the COVID levels that are being tracked. COVID levels also incorporate the increase in cases and increase in hospitalizations as well. And that's a key metric to keep in mind, because the New York City Health Commissioner previously said that if hospital rates triggered it, that's when the city could really go back into a mask mandate mode. And so that's where we have to keep our eyes for right now. But as it stands, really just a lot of focus on this case rise right now.
It's amazing. On Broadway, the mask mandate just came off. Yeah. People just got to return to plays, and now we're talking about it going back on. All 5 New York City boroughs back in the CDC's high-risk category. Cases overall in the country still high, but hospitalizations and death, where are they?
So hospitalizations they have seen some uptick, but not enough, again, to that point of it's not at a concerning level. And so that's why we haven't seen that trigger of the alert for the city get too high. It's now at medium. It was high in June, and then by the end got to medium. So we are seeing that some waves come with those subvariants, like you can see on your screen. We're talking about that difference between what the old guidelines would show, which was just tracking cases alone, and then now these newer guidelines incorporating all of these other tactics and other strategies and metrics. And that's something that, experts have been pretty critical of. The Scripps Research Translational Institute's Eric Topol has been especially, aggressive about calling out the CDC for basically hiding that other map within the data tracking that they have. It's harder to find. And also the fact that they're not paying as much attention to those metrics nowadays. So because we haven't really heard anything from the CDC, right? Unless you're tracking it like we are, you don't really know that this is happening.
You can see the COVID fatigue on my face. I took 3 tests and still had to wear a mask on a film set earlier this week, and we're just not ready to go back. Some Los Angeles news affiliates are reporting the possibility of masks coming back on as well. Anjalee, best of luck. Have a good weekend. Let's avoid it.